Hi, everyone. Thank you so much for coming. I just want to introduce myself. I'm Dawn Basciani, and I'm a chiropractor at Brighton Hill Chiropractic. And I want to introduce two other people. They're two staff members. One of them is the owner of Brighton Hill, and that is Dr. Carrie Getch right here. And the other is my secretary, Kelly, right here. And they are going to be handing out some pens for you guys to take notes or write down any important stuff you hear. So first, I just wanted to give a little bit of background about myself. I just recently graduated chiropractic school about 6 months ago, and I've been a chiropractor here in Syracuse since. And I'm also certified in Graston Technique, which is what I'm here to talk about tonight. And I'm M1 and M2 certified, so it's kind of like an advanced certification that kind of is a soft tissue technique that kind of supplements chiropractic really well. And I'm also active release technique certified, and it's another soft tissue technique that's really beneficial as a supplement to chiropractic. And I am also a certified personal trainer, and I have experience treating at the Ironman Lake Placid, doing soft tissue stuff as well. And so next, I just wanted to talk about Graston Technique and how it was founded and who founded it. It was founded by Dr. Syriac, and he was actually an orthopedic surgeon. And he was coined the Einstein of orthopedic medicine. And his diagnostic system was really based on conservative treatment of soft tissue injuries of the musculoskeletal system, which is a Graston approach. The company, they have 5 U.S. patents on their technique on 6 different instruments. And the founder is Michael Arnott. He's the president, and it's an 18-year-old company. So this is a relatively new technique. You know, it hasn't been around, but they're doing a lot of different research on it now coming out. Most of it is on animals, but they're starting to do more case studies on different athletes and humans. So next, there's 6 stainless steel instruments that make up the Graston technique, and I have them here, and they look pretty much like this, and they look kind of mean, but they're actually pretty effective. And basically, they work kind of like how a stethoscope. It amplifies the sounds of the heart. The Graston technique amplifies different adhesions and different trigger points that are in the muscles. So you can feel a vibration when you're going over a different muscle, and it really helps to identify where the problem areas are. And next, the clinical applications of Graston technique. So as you can see, it can be used for a lot of different things, whether it's cervical sprain strain or lumbar sprain strain, carpal tunnel syndrome, plantar fasciitis, foot pain, elbow pain, rotator cuff shoulder problems, knee pain, ankle pain, fibromyalgia, scar tissue from different surgeries, trigger finger, shin splints, and tendinosis. And tendinosis is becoming a big one because a lot of people have what's called chronic pain, and it's pain that's been there for a really long time, and that's what a tendinosis is. So it's like if you have a tendon that's inflamed, it's called like epicondylitis, meaning it's acute, it just happened, but a lot of people, they experience pain for a long time thereafter, and it's called tendinosis then when it's chronic, and Graston can be very effective for treating that, and we'll learn more about that further on. So next I have up here an outcome summary, and basically what you can see here is the different injuries on the far left, and then you see the average treatments next to it. So pretty much you can see that an average treatment session of Graston typically is between 8 and 15 treatments. And so what this chart shows is the percentage of resolution equating to attaining the patient clinician goals, which was 1, to increase function, and 2, to decrease pain. So pretty much what you can see here is that complete to good resolution, which is 80% or better improvement. So looking at Achilles tendinopathy, you can see that in an average of 8 treatments, 92% of the people had good to complete results. So as chiropractors, we deal a lot with low back pain, so that was average of 11 treatments, and 87% of the people had complete to good results. So complete, excellent, good, and then the other two categories were fair and unchanged. So as you can see from this chart, I mean, pretty much it's ranging between 80 and 90% effective for most of these conditions here. Next is the frequency of treatment. So everyone wants to know, how long is it going to take to get better? Patients usually receive 2 treatments a week for 4 to 5 weeks, and most patients have positive response by the 3rd or 4th week. So absolute contraindications. So you would not want to get Graston Technique if you had any of these different things. So the first one is open wounds or unhealed sutures. But certainly after they healed would be definite indication for Graston. Thrombophlebitis, which is like a deep vein thrombosis type thing. Uncontrolled hypertension. Inflammatory conditions due to infection. Contagious or infectious skin conditions. And myositis ossificans, which is like a calcification from a major trauma. Or osteomyelitis or a bone infection, or unstable fractures. So care instructions and possible side effects. So there's, with every good thing you have different risks that are associated with it. So first thing is bruising. Since normal tissue binds with involved tissue, it has a blood supply. So with this, bruising can occur, but it can be controlled by using ice after the treatment. Soreness can happen, and that's just because you are breaking up a lot of different adhesions that's in the tissue. So soreness could be there, but it usually goes away 48 to 72 hours after, and it can be controlled with ice and stretching. Water intake is recommended after, just to promote proper healing, kind of like when you go for a massage, they recommend water. And one really important thing is to, enhance the, recovery and speed up the process. A home stretching program would definitely be a good thing to do, and that is also given with the treatment. Okay, so next I want to talk about the benefits of this. So first is it alters spinal reflex activity, and I have a detailed example I'm going to go over a little bit later. And number 2, it increases rate and amount of blood flow to and from the area. So basically this does 2 things. With the blood flow, you get fibroblast cells, which are connective tissue repair cells. So connective tissue is the main structural foundation of the body. So whether it forms tendons, ligaments, muscle, it's going to help repair the body. And it also mast cells. And secondary to mast cells release histamine, and that's an anti-inflammatory. So anti-inflammatory also is a good thing to help repair the damaged area. And then it fosters faster rehabilitation and recovery, which I'll demonstrate later as well. Also, it helps break down collagen cross-links and splays. So if you think of all the muscles, they're all running parallel. But if they have these cross-links and they all get bunched up like this, the Graston can help break them up when they sense the vibration. They help release those cross-links. Also, stretching connective tissue and muscle fibers is one of the things that Graston does, because while the Graston treatment's going on, the muscle is being stretched in some instances. It increases skin temperature, and it also facilitates reflex changes in the chronic muscle holding pattern. And I have another example later on to demonstrate that. So how is scar tissue different from other tissues? So as you can see here, you see healthy tissue, you see strained tissue, and then you see the scar tissue healed. So you see all those scar tissue in the cross-links that prevent movement. They decrease range of motion. So obviously that's going to leave the muscle weaker and less flexible. So when tissue's damaged, it will heal in a haphazard pattern or scarring that you can see right there. So this is an example of how Graston helps to facilitate reflex changes in the chronic muscle holding pattern. So we can see right here, this is a person laying on their back, and you can see how that foot is pointed outward, so it's kind of like out like this, and that's called a positive piriformis sign. And it's actually this muscle right here that is causing that. And so that can be caused by that muscle spasming or just being really tight. And so you could see how, that would cause a problem or pain. And being the chiropractor, this is also the sacroiliac joint right here. And so it could affect the sacroiliac joint where fixing this, a chiropractic approach as well as the Graston technique would obviously be beneficial. But so basically looking at this example, you could see that this muscle is affected. So what Graston would do with this is we would find out where the adhesion is in that muscle and work out the adhesion. And then we would give a piriformis stretch, which would help stretch that muscle, get that muscle moving its proper range of motion again. And then this would, in fact, reduce the pain and help facilitate that foot to come back naturally where it was straight up like the left one in that picture. Okay, so this was from the Journal of Orthopedic and Sports Physical Therapy, and this is actually a really cool study. This was done on rat MCL. So this is the medial collateral ligament in the knee. And in this first A picture right here, you can see a normal ligament. And in the normal ligament, you see all the fibers are running parallel, and those black things that are up in there, those are fibroblasts. Then in B, you can see this is a damaged or injured MCL ligament, and this is with no Graston treatment at all. And you can see the big scar in there. This is 4 weeks after. Now, C, you can see this is 4 weeks after, and this was with Graston. This was actually with GT6, which is this Graston tool right here they used on the ligament, and that was a response, and you can see that it just looks like it healed a lot better in a straight line. Now, this is looking at electron microscopy, so this is the same thing done before, but this is just looking at a different image. And again, you can see that this is the knee ligament right here, and that's normal. This one, see that 4 weeks after without Graston, this week's 4 weeks after with Graston. And you can see the significant granulation tissue in that ligament. So what this is basically saying was that with the Graston technique, you can accelerate, speed up the recovery of that ligament. And so the results of this study demonstrated as well that when Graston was used, the ligaments were found to be 43% stronger, 40% stiffer, and able to absorb 57% more energy when compared to the contralateral knee that was uninjured. And basically what they did was they took this bone right here, they put a force pulling it out, showing that that ligament was stronger with the Graston. So now that we talked about ligaments, I'm going to talk about tendons. And first, I'm just going to talk about the healing process of tendons. So number one is the inflammation phase. And basically, in this phase, fibroblastic cells migrate to the injured site. We talked about fibroblast cells and natural framework or connective framework of a biological cell tissue or organ. We can see they're very important in healing. The second phase is proliferation. They're activated, they increase in size, and they're able to synthesize collagen. Third phase where they realign in the so they're parallel and you can have motion. So next, this study was done, and basically what they found is that Graston was used on rat Achilles tendon. It healed by activating fibroblasts. Increased amounts of fibroblasts going to the area where Graston was being applied. As well, they found increased fibroblast proliferation, and so that basically is the second stage of things, the amount of fibroblasts coming to the area. This next study shows that not only did it increase the number of fibroblasts going to the area, but it also increased the size of the fibroblasts, those connective tissue, the structural framework of our bodies. And it also studied that heavy pressure promoted the healing process to a greater degree than light to moderate pressure. And that friction massage by hand increases circulation and fibroblastic proliferation, and clinically it is recommended that friction be applied for 20 minutes or more. But if you use the instrumentation, the friction time was reduced to 1 minute, and it was more penetrating and specific. So this is another indication that Graston technique might be a good thing to use for musculoskeletal injuries. How big were they? They're pretty small. They use this GT6, and it's actually interesting that you say that because there are 6 different tools, and they actually have different contours and shapes to work different muscles of the body. So GT6 was used because it was the smallest one, and they actually used this edge right here of it right on the rat tendons, and they had pictures in the study. It was really cool to see it. But, I mean, like this one is curved to use on a hand, you know. A different one like this could be on a different body part. For example, like you'd use it on a quad like this. So. So next, this is an example about how it can change a reflex pattern. And I picked the spinal example because we are chiropractors and that is what we like the most. But it can be effective for other things other than just the spine. So basically, the spinal stabilizing system consists of 3 things. And one is the neuromuscular control unit here, which is your brain. And then you have the spinal muscles here and the spinal column here. And it all works as like a feedback loop. So the spinal muscles are talking to the brain's talking to the muscles. And same thing with the spinal column. So basically where Graston fits in is Graston fits in right here where it's affecting the muscles. And so it's working to control muscle activation and coordination. So it's looking at, is a muscle in spasm? Can we turn it off? Can we turn it on? Onset, magnitude, and offset. And then if we look at the spinal column, you know, we talked about the piriformis and the sacroiliac joint that was right here. Well, here, in all the joints are big mechanoreceptors right here, and those communicate with the brain. So if we can have effect on those mechanoreceptors, we can have an effect on this whole feedback loop of controlling the muscles, which is what we're looking to do with Graston. So here's an example. The interspinous ligaments, which this is a spine here. These are all the vertebral bodies. These are the spinous processes coming out. The interspinous ligament is right in here. And basically, Warren Hammer, he's a leader in soft tissue in this industry, and he found out that applying tension to ligaments stimulates mechanoreceptors and a reflex arc that recruits muscular activity. And so when you apply Graston technique to these interspinous ligaments, which are right here on your back, that it can have a positive effect on soft tissues. And so we can see this because interspinous ligaments like C5 is right here. And so this ligament can cause pain in the shoulder. And, you know, for example, L3 is about right here, and this ligament here can cause referred pain to the back of your leg right here. So here's just going to show that if we work on some of these damaged ligaments that could have been damaged due to a bending and twisting type thing, that, you know, we could have an effect on referred pain all the way down to the leg. So the science behind this is that the interspinous ligaments are involved in both acute and chronic spinal pain, and that a single trauma or a cumulative microtrauma, which is repetitive injuries, doing something all day long, the same movement, or just sitting on your computer all day like this, can cause subfailure injuries of the ligaments and embedded mechanoreceptors, which we've talked about before, and that the injured mechanoreceptors generate corrupted transducer signals, which means that the corrupted muscle response patterns by the neuromuscular control unit. So basically, the whole connection of the brain and spinal cord can be affected by these ligaments and the receptors here communicating these messages to the brain, like spasm this muscle. And Graston could, in fact, prevent this feedback loop from continuing in this chronic pain cycle. And so that's all I want to say about the science behind that. Now, who uses Graston technique? This technique is becoming very popular, and we can see here it's used at the U.S. Olympic Training Centers, NBA, NFL, NHL, Major League Baseball, and even golf. And it even made it to the Olympics, and in 2004, you can see that this doctor is treating an Olympic runner, Debbie, with the Graston technique on the knee before she ran. Yes?
I went to South Korea for and I had a son, but the issue with that is they call it sex and one sex, but I didn't understand it. And it's father who understands his son, especially
I'm not sure. I mean, this would obviously take an assessment to see what's going on in there, you know, whether this is Graston Technique could be used to fix this would, you know, be based on, you know, your history and a lot of other factors that are involved. So, right. I'm not exactly sure what she did. I need a detailed. Yeah. But, you know, if you came by our office, we could definitely, you know, assess the ligaments and the rotator cuff and find out what's going on and see if you could be benefited by chiropractic or Graston Technique. So next, does anyone else have any other questions? Yes. It's okay. I would say that it's not well, it could be permanent or could not be permanent, because when you do these repetitive movements in a job or whatever you do, or if, for example, you know, you have a problem in your leg and you're a big pronator and your knee goes in and so you're walking like this, obviously if I fix something in there like a adhesion or whatever using the Graston Technique, it's more apt to come back, because in your life you're doing these things that are going to promote it to come back. Right, yeah, I mean, and obviously there's probably some arthritis involved in it, and can this be 100% cured? Maybe not. But could this give relief that you could live with at a certain pain level? Possibly. Of Graston Technique? Well, actually, what I do is I'm also certified in active release technique, and so that's a lot of PPs do a type of stretch where they're trying to release things. Well, I combine Graston and ART together. So basically, like, you know, you have an adhesion in your neck. Well, while I'm Grastoning that area, and I can do a demonstration to demonstrate this as well, but while I'm Grastoning over an adhesion, I'm having the person move their neck to stretch out the muscle at the same time. So we're working to increase range of motion and break up the adhesion at the same time. So we're kind of combining two different techniques. So to be honest, a lot of physical therapists do use Graston Technique, maybe even more so than the amount of chiropractors that use it. Occupational therapists use it. Some massage therapists can get certified in it as well. So it's not just chiropractors doing this technique. So physical therapists may utilize it as well. Well, basically, there's two different certifications. There's M1 and M2. So M1 is the most basic one, and then M2 is a more advanced one where you are actively moving through different ranges of motion, and it's, you know, athletic-based, you know, for sports injuries, but it's also for, you know, the general average day person. So there's a seminar that you study in advance and videos that you watch, and there's, you know, more than 24 hours of one-on-one training that, you know, is part of the chiropractic curriculum at the college that I attended. Right. Okay, so there's basically I scan the tissues. So when I scan it, I find out where the adhesions are, and then I work where the adhesions are, as well as, you know, getting the range of motion back. So what I can do is I can pick someone to come up, and we can actually feel them, and you can go over and feel it yourself if you like. Would you like to feel it? A couple more questions. I mean, that more chiropractic would be my treatment of choice for that, with an adjustment. affecting those mechanoreceptors. But if the muscle is involved with, you know, a stenosis or a disc, you know, a lot of times when the disc is injured, the muscles can spasm around it. You know, Graston may be used as a supplement to that, but I would treat that more chiropractically with adjustments. This is a soft tissue technique for muscles, but can it affect like a sciatic type pain? Well, where's the sciatica coming from? If it's coming from a damaged or injured ligament here, it could be effective. But if it's coming from an impinged nerve somewhere, I would say that chiropractic would be more effective for that. Yep. Time. Yeah, I mean, obviously, right after you have the surgery, you know, they usually wait about a week to two to let it heal up first and then start doing it. In these studies, they waited a week, and then they got right in and started doing it. But obviously, it's going to be more effective initially. If you wait so many years after to do it, you know, the scar tissue is already built up. Now, could it still be effective then? Yeah, it's worth a try. May it take a little longer? Probably. Would it get 100%? Maybe you're less likely to get 100% because you had years of developing. That's great. That's awesome. Uh-huh. Yes? Ralphing. I think it's a little bit different. These tools are patented, and what makes them so special is, I mean, they have this beveled edge to them, and the ability to amplify the lesion so that you can feel it. It's like a lot of times with my patients, I'll be like, oh, do you feel that when I go over that? They're like, oh, yeah, it's right there. How did you find that? So it really helps. Yeah, I do feel it, because what happens is when I go over an adhesion or a trigger point or something, the tool will vibrate, and it will give me a vibration that I know that I'm on something. So, I mean, I think it is different from, you know, other things. Well, we're at our office, we have a package. Now, if you have an adjustment with it, it's going to be different than what just the Graston would be. But we have a package that's $100 for 5. So, you know, treatments typically last 10 to 15 minutes. The first one would be a little bit longer just to do the assessment. Yep. Well, basically, we were actually having this discussion in the office the other day. Fibromyalgia is, you have 19 different trigger points. You need 11 of them to be diagnosed with fibromyalgia. And so, could Graston help with the trigger points and working those out? Yes, possibly. But it is thought to be that fibromyalgia is actually a neurological thing. So can Graston help change the neurological cause of it? Probably not. I use the tool to work the surface, and then with it I do some stretches sometimes. Maybe not the first time, but as time has progressed and getting things moving a little bit better, sometimes as, you know, the patient is moving their neck while I'm doing it. But it's mostly using the tool, and then there is a emollient, and it's just something to help the tool slide along the skin that's used. There's nothing in it except vitamin E, and it's just to help the tool slide and it doesn't cause redness. Can be around the area of where you're working, but I mean, that goes with anything. Yeah. I do, and it would require, you know, shirt off to get into this area here. Are you still willing? No. Uh-huh. You can't do this motion. Okay. I mean, are you willing to? Yeah? Are you willing to have other people feel what the adhesions feel like? Okay, would you like to come have a seat? What? Yes. It is. It is. They call it petechiae hemorrhaging. Sometimes the skin, when the adhesions release, your skin can have a reaction, and it is possible for that to happen, but it usually goes away within 24 to 72 hours after. It's like a red, bumpy thing that happens on your skin. Some people have it if they have really sensitive skin, but it's the adhesion working itself out. I'm looking at my coworker right here thinking, not really, but we do it sometimes as a supplement. Can we expose this? It's your right shoulder or your left? Right. Oh, I see you have a scar over it? A scar? Mhm. Okay, so that's nothing. Okay. You're not on any blood thinner? Well, I think blood pressure. Okay. It's monitored, it's managed. Okay. Okay. Well, where are you having the pain? Right over. Can you take that shirt right off? Are you good? Do you want to face away from everyone? You want to face towards everyone? You don't care? Let me just slide this chair out so I can get in here. And you're okay with having people come up and feel what this feels like? Okay, so I'm just going to use a little bit of emollient here on your skin, and I'm going to scan and see what I find in here. Now, this may be a little cold. Just a warning. Can I just get you to sit up straight and back right towards the chair? Yeah, perfect. There you go, right there. There's an adhesion right there. You feel that, right? Yeah. So you're feeling with me. And you feel right in there how it's bumpy and it's not smooth. And this is the muscle that can inhibit that muscle coming around here. Mm-hmm. I feel it like right down the arm. Okay. Let's see what we find down in there. Rotator cuff problem? I'm not exactly sure yet. Have you had any x-rays or imaging? Arthritis, Wow. You feel this right in there, right? Yeah. And you see how his skin is getting red right in that area? We're over an adhesion right here. We're over a bumpy spot where, it's not moving. He can feel this too. This is a little bit uncomfortable when I'm doing it, but this is breaking up some of that that's in there. Probably got butter knives in the kitchen. How is it different than manual? Well, it's deeper, so it's a little bit more specific. It's getting in there deeper than normal. Yeah, and they say based on that study, that they were studying that regular massage takes 20 minutes to do 1 minute of what you can do with Graston. You were the woman that wanted to feel what one of these felt like, weren't you? Did you want to feel this? You're okay with her feeling this?
Yeah, why not? I've gone this far now.
You feel this right in here too, right?
No.
I mean, it's a little bit uncomfortable and tender, I'm sure.
I mean, it's constantly intense.
So if you just hold this tool, I apologize, there's a little bit of emollient on there. If you hold this, and you're going to come right over here, and you're going to feel it bumpy right in here. Do you feel like there's a bump? It's not smooth.
Yeah, there is a bump.
Mhm. Mhm.
That's where it hurts.
the whole area. No, it's not just scar tissue. Like if you've got a tendon injury like a medial epicondylitis, lateral epicondylitis, or a ligament that's injured or that was torn, it can be effective for just increasing range of motion. Yep, go ahead, grab one. Does anyone else want to feel what this feels like? So you can feel if you go right over here, if you just hold on each side of the tool. And it's probably better if you just come in an angle like this and you can feel it, how it's a little bumpy. If you angle like this, a little bit more that way. It depends. You start obviously with a little bit less and then you kind of increase it based on patient tolerance. You know, you can see their faces if they're like, you're hurting me, like, and you back off a little bit. Do I feel it? Yeah. When the patient, within, sometimes it takes, 3 to 4 visits to kind of feel like, wow, this is really better. Yeah. I can feel it because I feel less adhesion in there. Yeah.
Like crunchy peanut butter turning into creamy.
Mhm. Did you want to feel it? He's going to get red if we do all this. So basically, you're just going to rub right over here, and you're going to feel the adhesion in there.
What's the difference between this and the tools that
I'm also a
physical therapist?
Well, do the physical therapists have these tools?
I don't know what the problem is.
They have a different one?
Yeah.
There's a couple different ones. Yeah, those are called gua sha.
Yeah.
These ones are patented and they're research. These are what the research is studying, not the gua sha tools. They're focusing more on, using them. It is. The Graston says. It is highly specific, though, versus. It's different in the sense that the Graston, they have a certain beveled edge, and they've studied different angles of using the tool, and the gua sha does not have those same angles. Yeah. Mhm. I could try a new tool here. So. They will not sell Graston tools to anyone unless they are a licensed health professional. They have them aftermarket, like I've seen them on eBay sold. Now whether it's totally, whether that's right or not right or what. Occupational therapists, physical therapists, chiropractors. Could you call and say, I'm a nurse practitioner, I would like to do this as well? They might allow it. And he's a health professional? Well, yeah, then I would call up the company and I would ask. I would call up and ask them. Right. 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 What's that? Yeah. Stainless steel. Mm-hmm. Did you want to try with this different one? This one does the same thing. We could actually get them moving while you try with this one. Would you like to? Are you open to? I'm going to give you this. I'm going to show you what to do. Okay. So now we're going to have him do a movement. We're going to have him bend his neck back here, and then you're going to look down right towards your left foot as far as you possibly can. So you're going to right from here, and then you're going to move straight down to there. So I want you to do that movement slowly while I'm doing Graston. Don't worry about what I'm doing. Just keep doing that movement. Do you understand? So you're going to look back here, and then you're going to look right to there. Okay? Keep going. And would you like to feel what that? So if you You go right over this area, right in here. You can feel, you can feel right there is a bad spot. You can feel it, yeah.
And this is from a tattoo removal too?
I think it was mole removal, possibly. Yeah.
But you don't know what's wrong?
Nope.
Yeah, you want to find out?
Nah, I think that's it. Eventually, I'm hoping maybe I'll find out here.
Cervical? I know, men don't rush into those things.
Yeah, right.
But you should be able to palpate it, right? Also, in that?
Palpate it? Yeah.
Because I can feel it. I mean, it stands right
Yeah,
up.
I mean, you could feel them right in here.
Yeah.
You could feel that, right?
Yeah.
Exercises? Well, for him, being that if you look at him here, he's got a rounded shoulders and he's got the head a little bit far forward, and we're working this area to open this up to bring this back. So for him, a good thing would be something like putting your hand here and walking through a door to kind of open this up. So he would be doing that exercise or stretch supplementing the Graston when he goes home. Other stuff to bring his neck posture back would be to do like a neck retraction. So this is good for any of the general public who's got bad posture and slouches, would be like just when you're sitting in the car at a stoplight, tuck your chin back in doing a neck retraction. So not like you're going back like this, but like you're doing a neck retraction here. So you're almost giving yourself a double chin, but you're stretching out these muscles back here to get this posture back where you're up here. Now at a position like that, your joints are at the least amount of stress. There's the least amount of stress on all your discs, and you know your muscles are also in the. Yep.
Quite cool. Are you done with my session yet?
Would anyone else like to volunteer a hand or something? A hand? Come on up. Soft tissue therapy is not typically covered by insurances. We include it as part of a chiropractic adjustment if you're getting a chiropractic adjustment, and it's just something small that we're going to be doing. If we do it as a big add-on where we're doing multiple regions, because some people, they're like, okay, my back hurts, but now, you know, my whole leg is affected, and I want my hamstring and my foot Grastoned, you know, then we're going to do a Graston package with the adjustment. But if it's just like, okay, we're going to see if, you know, doing some Graston in your low back couldn't help, well, that we're going to include that as part of the chiropractic adjustment. So it depends on what, you know, with sciatica and stuff. We've been working with tons of runners as of recently. So give that to her. Great. Welcome. You had the hand?
Good. You should hire her.
Do you have a hand issue?
Yes, I do.
What's your hand issue? Okay, so you've got some arthritis in there. You have pain. Okay, so obviously Graston is not going to cure arthritis.
I can whittle one of these out.
It is patented, remember. Before everyone leaves, I do have a free, one second, I do have 15-minute aquabed session at our office if anyone can answer 2 trivia questions. So number 1 is who founded Graston Technique? And number 2 is how many Graston tools are there? Okay, so who founded it? Okay, so like that was you who said that? It is an aquabed that we have at our office, and it is heated, and it has jets that go up and down, basically whole body, and then we can set it targeted towards a specific area if you wanted just your neck or just your low back. We have a couple people in here who use it and could probably attest to how effective it is. Yeah, I use it on my lunch break sometimes. It's really great. I'm not sure because an arthritis condition is different than a soft tissue or a tendon, ligament. But could it help in the joint with the mechanoreceptors? And could it? What is your forearm is what? So we're going to work your forearm. Okay. We'll do your forearm here. What's that? Carpal tunnel. It helps with that too. Average treatment for carpal tunnel is 8. Now, if you've done something with your hands and it's been there for, I had someone come in who had it for like 30 plus years and did nothing about it. It's pretty difficult to treat something like that. You could try. I'm just going to feel this heat here. So you are Dr. Gatt's patient. I remember seeing you at the office. HIPAA things.
I wanted to give you breakfast, but that's what
I saw they had the gluten-free, the one that got it at Yum Yum, was it? Yeah. They were advertising it out there. Yeah. Mm-hmm. And so I can feel right in here you have some. You can feel that?
Well, yeah.
Yeah. You can feel a little bit in there, too. Now, when I do this, I'm going to have you move your hand from here, and then you're going to move it right around. It doesn't do that. Can you do the best that you can while I'm doing this? Nice and slow. Yep. So you're feeling the adhesions, how it's bumpy? Because I see the tool sliding, yeah. So you're thinking of how you can make one of these at home? I'm sure my father-in-law could make one, too. He's sitting right behind you. And my mother-in-law right there. And my husband right there. He's right here. Okay, just relax. Do you feel that this is a warm sensation? No. A lot of them aren't. It doesn't feel warm right now? No. It might after, because the increased blood flow usually gives you like a warming sensation, yeah. Now, where was it in your finger? Oh, it's in here? What's that? Why is it different? It has this beveled edge right here. You can see how it's curved right here, and they've really studied this and shown the angle at what you do it. And there's a skill towards doing it at the angle you do and the curves you do and the movements that I have her putting through and going after I'm going after specific muscles for certain things. Exactly. It's like if I'm going to treat, bear 1 second. They call, like the Quervain tendinosis with this tendon right here. Well, I know I'm dealing with these two muscles, abductor pollicis longus and extensor pollicis brevis. I'm after two specific things. I'm not nothing against any other profession or a massage, but I know exactly what I'm going for, and I'm putting in a movement that's going to shorten it and then stretch it while I'm doing it. It's very specific and targeted. That's what it's becoming a big thing now with the text messaging. Everyone's texting with their thumbs, and they're getting this. Yes. You can set up. We did not bring our schedule. So what we were going to ask people to do was, if you go on our website, through Demand Force, we have a program, you can request an appointment, and then we'll give you a call tomorrow or whenever you request the appointment. Kelly's in tomorrow at 8, so people can schedule. Nope, you can do just Graston. Yep. That was what I just had her doing as well. So, you know, she was having some adhesions and things in the extensor muscles of her forearm. And so while I was Grastoning, she was moving in this range of motion. And so we were using an active release type thing. You know, what I might do is if I find a big one, you know, I'll do some active release on her at the same time where I'm working out. Right. It's a very big thing. And I mean, active release technique, it's now at all the Ironmans. They're there, and these people, I mean, they beat up their bodies, and, you know, they've found the success that it's given them. And they have active release technique for neck. They have a spine one, they have upper extremity, lower extremity, and they have biomechanics. And I've done all 4 of them, and it's just incredible. I met the guy who founded it, Mike Leahy, and he's absolutely incredible. He's good stuff. So it's cool to be able to combine 2 different techniques together and kind of make it work. Yeah, and what my colleague and I find, because there's another doctor in my office who does soft tissue work, I'm certified in it. He's kind of focusing on a different thing, but we've found that when we do the adjustment with soft tissue, the patient gets better so much faster. So, you know, even though the soft tissue, the insurance companies are not looking for us to do that, but we're just finding it just is an essential part and needs to be included in most of the treatment. So we're doing it. Well, orthopedic surgeon, he was the one who founded it, was an orthopedic surgeon. And the other orthopedic surgeons, I will tell you, I have been on the phone with some of the ones in Syracuse, and I've talked with them about it. Now, there's some of them that are very open to it. There's others that are not. You know, it's a new and upcoming thing. When I did a rotation in Buffalo, I worked at the Buffalo Spine and Sports Medicine, and we worked with pain management docs, and they referred tons of people to us. And so the pain management docs, they get it, and they understand that, because they're willing to try conservative treatment before they try all these, you know, surgeries and all that. Not that surgery is not indicated for some things, it definitely is, but not for everything. And now at University of Pittsburgh Hospital, they've stated that they're not even going to let someone in for a spine surgery until they've had 3 months of conservative treatment. So it's a huge thing for us as chiropractors, but it's a huge thing for soft tissue, because it's kind of like we get a chance. But that's at University of Pittsburgh, so it's like, now that that big hospital implemented it, maybe some of the other ones will start to pick up and start to do the same thing. It depends on how serious the trauma. Now, if there's red flags, absolutely, you must have it. Now, typically what we do, if it's non-complicated back pain or a non-complicated thing, no, we try conservative treatment first. If in a month it's really not gotten anywhere, then yes, we would recommend it. If it's progressed but it's still not totally there, then we wait till 3 months or 2 months, or it's red flags. You know, you've got your typical red flags, like if someone's got muscle weakness, or if someone's got bowel bladder dysfunction, or if someone comes in and they've got a rust sign and they're holding up their head. You know, it's like we're trained to catch these red flags. You know, chiropractors are trained, you know, not just in musculoskeletal stuff, they're trained in history and physical diagnosis. You know, if someone comes in, they're like, you know, I just lost tons of weight and I have a fever and this and that. It's like, okay, well, you're not a chiropractic patient. You're a patient of someone else's. I need to refer you to someone else. And being at our location, we're at 170 Intrepid Lane, and right down the street, you know, we have orthopedic surgeons. We have Dr. Barish, who's a primary care. I mean, it's, you know, the whole patient-centered medical home atmosphere where it's like we're all there right in the same location. So we work together with them. We also communicate with those other docs there, you know, and they communicate with us as well about certain patients. I would say that I'm working on it. It's very difficult to get an orthopedic surgeon to sit down and listen to you. And I've gotten them on the phone for about 10 to 15 minutes to listen to it. I've gone to different offices to try and talk to them about it. It's difficult. Right, and they're starting to get it. You know, for example, Krause Hospital, they have a integrative health alliance where now they're going into Krause Hospital and they're doing Reiki on people, and they're doing all these alternative different health things in the hospital. And so it's slowly but surely different people are starting to implement. I'm not sure. Yeah, I mean, I'm not sure why they're not referring. I mean, it's hard to say. I'm sure everyone has their own. Yeah, I mean, they're trained to do what they're trained to do, and they know it very well, and so, yeah. Anyone else? Yep. To roll it out. Sprain strains, absolutely. Yep. Foam rollers actually work really great for that too. It's called a stick, I imagine. The stick? A rolling pin? Okay. Yeah, this works really well for sprain strains. Usually about 8 treatments, 2 times a week, you know, for about 4 weeks. I mean, it has been shown to help for scar tissue. I've seen it, you know, after raised things like that. Do I have experience treating what you're talking about? I have not seen. Haven't seen it. Could it be effective based on what the science says? Yes. Is there, you know, a technique that I've been trained in to help that? And would I know it? Yeah. Would it be worth a try? Most likely. Can I guarantee that it's going to make it go away? No. You're welcome. Thank you for coming. That's right. And now typically our package is for one region. So one treatment's for one region. You know, depending on how much time we spent, you know, would based on how many packages you need to do for one treatment. Because it's like some people then come in, they're like, oh, I want my whole body, you know, and it's like I'm going to be there for an hour grafting one, you know, all day long pretty much. We only x-ray if we find it necessary, but yeah, I'll do an assessment. And, you know, if we think it's really serious, we'll check out all the ligaments, we'll check out range of motion, find out what's going on, do a couple orthopedic tests, make sure it's not something serious. If it's not something serious and we think that it is a sprain strain of a ligament or a muscle is involved, then we'll work on it, you know, right away. I do osseous adjusting, so with my hands. I do activator technique using, it's a tool. Obviously, the active release technique, the Graston technique. Pretty much, to me, my favorite one would be the osseous adjusting. So you hear a cavitation or that noise that people say that they hear, where we're finding where the joint's not moving, we're putting a force into it, and we're getting it to move again. We're restoring range of motion. And with that, you get so many other benefits because on each joint, you have all these mechanoreceptors, and they're signaling pain, muscle spasm, inflammation. And once you get that joint moving better, you know, the mechanoreceptor can fire messages to the brain better, and so you're getting improved, you know, in range of motion, decreased inflammation, decreased pain. You're getting all these other things with it. So, you know, if an ankle, it's not moving, an adjustment to the ankle, maybe, you know, in addition to the Graston technique would be a good thing too. You're welcome. Yep. Would it help with the knee? Yes, it does help with patellofemoral disorders, tracking problems, not sure, you know, ligaments healing, not sure specifically what you're asking, but yes, it can help with knee problems. If it's fractured, no. Exercising is a huge thing, and you know, with Graston, stretching and exercising and different strengthening motions are a good thing. And as part of the whole approach that we do at our office, we always do stretching and strengthening exercises, but that usually comes after, because how do you stretch something and strengthen something that's not moving? So if someone turns their head here and they can't get that full range of motion, how do you stretch and strengthen that? So first we have to restore motion. Once we restore motion, then we can strengthen that segment. Yep. Torn meniscus. If there's scar tissue in there, usually from tears, you do have scar tissue. Could it help work on the scar tissue? Yeah. How would you get to the meniscus? Yeah, just on the very edges, it would be difficult to get to. Yeah. PVNS. Is this like a dermatology thing? Tumors and cysts. Okay, no, Graston is not for cysts. Uh-huh. And you have residual scar tissue there. And Graston is perfect for scar tissue, yes. In terms of removing a ganglion, no. Like, I do not Graston over ganglion cyst or anything like that. Okay. But yeah, after surgery, I've done, you know, people who have had post-mastectomy surgeries, I've Graston over them, and they've had great results and relief after that. So post-surgery scar tissue, yes. But it's just bumpy in there, and the range of motion is limited, and that's exactly what we're targeting with Graston, is increasing range of motion. It's worth a try to see if you can't break it up and at the same time do strengthening and stretching exercises to, you know, go after that range of motion. Yes, you can just buy one session to find out if it could work for you, if you like it, if you don't like it. Yes, we do have one package. I think it's $25 for one. Anyone else? Thank you all for coming. Maybe I'll see all of you guys soon.